Okay, madam.
So coming to the anterior triangle of neck. The anterior triangle of neck, coming to the boundaries of the anterior triangle of neck, the anterior triangle of the neck, anterior boundary formed by the symphysis mentae and to the suprasternal notch. And the posterior boundary of the anterior triangle is formed by the anterior border of sternocleidomastoid. So the anterior triangle in front, extending from symphysis mentae to the suprasternal notch, behind from the anterior border of sternocleidomastoid, and the base of the anterior triangle and the base of the anterior triangle, it is formed by the lower border of the base of the mandible, and an imaginary line extending from the angle of the mandible to the mastoid process. That forms the base of the mandible. And coming to the roof, it is covered by skin, superficial fascia, and investing layer of deep cervical fascia. And the anterior triangle, it is divided into 4 subdivisions by the anterior and posterior belly of digastric and superior belly of omohyoid. The anterior triangle, it is further divided into 4 subdivisions, that is muscular triangle, second one is carotid triangle, third one is digastric, fourth one is submental. So the anterior triangle is subdivided into 4 triangles. One is muscular triangle, carotid triangle, digastric triangle, and submental triangle. So coming to the muscular triangle here, so the muscular triangle here is the muscular triangle. The anterior boundary of the muscular triangle, it is formed by the symphysis mentae to the suprasternal notch. The anterior boundary is formed by the symphysis mentae and to the a line extending from symphysis mentae to the suprasternal notch. That forms the anterior boundary. And coming to the posterior boundary, it is formed by behind and above by the superior belly of omohyoid. So the superior belly of omohyoid is here, and behind and lower boundary is formed by the anterior border of sternocleidomastoid. So the muscular triangle anterior boundary is formed by a line extending from symphysis mentae to the suprasternal notch, and behind and above we have superior belly of omohyoid, and behind and below we have sternocleidomastoid. And coming to the content, there are no significant structures present in the muscular triangle. Only 2 muscles are present. They are stenohyoid and stenothyroid. Stenohyoid muscle arises from the sternum and extends to the hyoid bone, and stenothyroid muscle arises from the sternum and extends up to the thyroid cartilage. The stenohyoid muscle, it converges, this muscle is superficial and converges above. It converges above, and the stenothyroid muscle, this muscle is deep and diverges above. So those are the contents of the muscular triangle. So coming to the muscular triangle, so the muscular triangle, it is bounded anteriorly from the symphysis mentae to the suprasternal notch. Posteriorly, behind and above, we have superior belly of omohyoid. Behind and below, we have sternocleidomastoid. And the floor is formed by stenothyroid and stenohyoid muscle. Stenohyoid muscle, it arises from the sternum to the hyoid bone. The muscle is superficial and converges above. So the muscular triangle, it extends from the symphysis mentae to the suprasternal notch, and behind and above we have superior belly of omohyoid. So this is the superior belly of omohyoid, and behind and below we have sternocleidomastoid. This is the sternocleidomastoid. Coming to the floor of the muscular triangle, it is formed by stenohyoid and stenothyroid muscles. Stenohyoid muscle is superficial and converges above, extending from the sternum to the hyoid bone, and this is the hyoid bone. Here is the hyoid bone, and stenothyroid muscle extends from the sternum to the thyroid cartilage. and this is the stenohyoid muscle. This is stenothyroid and this is stenohyoid. Muscular triangle does not contain any significant structures. So that's about the muscular triangle. And coming to the carotid triangle. Carotid triangle, it is formed by, coming to boundaries of the carotid triangle, in front and above it is formed by stylohyoid and posterior belly of digastric. In front and below it is formed by superior belly of omohyoid. This is the carotid triangle. See, so this is the carotid triangle. In front and above it is formed by the stylohyoid muscle and posterior belly of digastric. In front and below it is formed by the superior belly of omohyoid. So this is the superior belly of omohyoid, and behind we have anterior border of sternocleidomastoid. These are the boundaries of the carotid triangle. And coming to the contents of the carotid triangle, we have common carotid artery, internal jugular vein, vagus nerve, so coming to the common carotid artery, the common carotid artery at the upper border of thyroid cartilage, at the upper border, so the common carotid artery ఇది ఆఫ్ చేసేయండి ఒకసారి, స్కెచ్ సరిగ్గా లేదు, రెడ్ కలర్ ఉంది. So, contents of the carotid triangle: common carotid artery, internal jugular vein, spinal accessory nerve, loop of hypoglossal nerve, and vagus nerve, and parotid gland. Some part of parotid gland is also seen in the carotid triangle, and jugulo-digastric and jugulo-omohyoid group of lymph nodes. Jugulo-digastric and jugulo-omohyoid group of lymph nodes are also seen in the carotid triangle. So coming to the common carotid artery. Common carotid artery, we know that common carotid artery, and on the left side it is directly arises from the brachiocephalic trunk. So common carotid artery is there. Common carotid artery is there. Common carotid artery on the left side it arises directly from the arch of aorta. On the right side it arises from the brachiocephalic trunk. So the common carotid artery at the upper border of thyroid cartilage. So this is the thyroid cartilage. The common carotid artery at the upper border of thyroid cartilage, it divides into two: external carotid artery and internal carotid artery. So the division of common carotid artery is very important. At the upper border of thyroid cartilage, the common carotid artery divides into external carotid artery and internal carotid artery. So the external carotid artery lies anteromedial and the internal carotid artery lies posterolateral. External carotid artery supplies most of the head and neck, and internal carotid artery, it enters into the skull and parts the main and plays an important role in the blood supply of the brain. So the external carotid artery, it gives 8 branches. Out of these 8 branches, we can see 6 branches here in the carotid triangle. So the external carotid artery lies anteromedial, and the internal carotid artery, this is the external carotid artery and this is the internal carotid artery. So the common carotid artery at the upper border of the thyroid cartilage, at the upper border of the lamina of the thyroid cartilage, it divides into external and internal carotid artery. External carotid artery totally gives 8 branches. Out of these 8 branches, we will able to see 6 branches in the carotid triangle. So coming to the branches of the external carotid artery, in the carotid triangle, we can see superior we can see superior thyroid artery, lingual, facial, occipital, ascending pharyngeal. So we can see 5 branches in the carotid triangle. Coming to the superior thyroid artery arises from the lower border of the hyoid bone, and this superior thyroid artery, it supplies the thyroid gland. This is the isthmus of the thyroid gland, and this superior thyroid artery from the external carotid artery supplies the thyroid gland. And coming to the lingual artery, it arises just at the tip of the greater corner of the hyoid bone. It arises here. So in the lingual artery arises here just at the tip of the greater corner of the hyoid bone. And coming to lingual artery, it forms the major blood supply to the tongue. And coming to the facial artery, it arises just above the tip of the greater corner of the hyoid bone, and it supplies the face by making a tortuous course at the lower angle of the mandible. And coming to the occipital artery, it arises opposite to the facial artery, and it supplies the back of the scalp. And ascending pharyngeal artery, it is the first branch of the external carotid artery. It supplies the pharynx. It goes along the posterior part of pharynx, and it supplies the pharyngeal region. So these are the 5 arteries they can see in the anterior triangle. Superior thyroid artery supplies the thyroid gland. Lingual artery supplies the tongue here. Lingual artery, it supplies the tongue here. And facial artery, it enters the face. This is the facial artery, it enters the face by winding round over the lower border of the mandible. Occipital artery just opposite to the facial artery, and it supplies the back of the scalp. And ascending pharyngeal artery, it supplies the pharyngeal region. This is the ascending pharyngeal artery, is the first branch of external carotid artery. So these are the 5 branches. They are seen in the carotid triangle. So the common carotid artery divides into external carotid artery and internal carotid artery at the upper border of the lamina of the thyroid cartilage. Internal carotid artery, it just enters the base of the skull. Through the carotid canal, it enters the brain and forms the major part of the blood supply of the brain. And external carotid artery totally gives 8 branches. Out of these 8 branches, we will able to see 5 branches in the carotid triangle. Superior thyroid artery supplies the thyroid gland. Lingual artery supplies the tongue. Facial artery supplies the face. Occipital artery supplies the back of the scalp, that is in the occipital region. And ascending pharyngeal artery supplies the pharyngeal region. These are the 5 branches they are seen in the carotid triangle from the external carotid artery. And coming to the after external carotid artery, we can see internal jugular vein here. Internal jugular vein lies lateral to the common carotid artery. Internal jugular vein lies lateral to the common carotid artery, and this common carotid artery along with the internal carotid artery, internal jugular vein, and behind we have vagus nerve. These three structures, they are enclosed by carotid sheath. So internal jugular vein, vagus nerve, and common carotid artery along with the origin of internal carotid arteries, these structures, they are enclosed in carotid sheath, which is derived from the investing layer of deep cervical fascia. So these three, and the nerve, the vagus nerve, it lies more on the posterior aspect, and this is the common carotid artery, this is the internal jugular vein. The carotid sheath on the back side of the internal jugular vein, it is very thin to allow the venous expansion of the vein. So the carotid sheath is thick on every aspect of the it covers all the common carotid artery, vagus nerve and internal jugular vein, but the carotid sheath covering the posterior aspect of the internal jugular vein, it is thin because it in order to allow the expansion. So the internal jugular vein is here, internal jugular vein, and the internal jugular vein along with the subclavian vein joins to form the brachiocephalic vein. And coming to the nerves. Coming to the nerves of the carotid triangle. So nerves are spinal accessory nerve, a part of spinal accessory nerve, and loop of hypoglossal nerve and vagus nerve. Spinal accessory nerve seen in the upper part of the triangle, and loop of hypoglossal nerve. So the hypoglossal nerve. So the hypoglossal nerve. This is the hypoglossal nerve. So this is the hypoglossal nerve. A twig from the C1. A twig from the C1 runs along with the hypoglossal nerve. A twig from the C1 runs along with the hypoglossal nerve and gives rise to two branches. One is nerve to thyroid. Nerve to thyroid, and another one is superior root. Another one is superior root of ansa cervicalis. Superior root of ansa cervicalis, or we can otherwise call it as descendens hypoglossae. So this is the hypoglossal nerve. And from C to C3 roots, another loop arises. We call it as inferior root of ansa cervicalis. Inferior root of ansa cervicalis. And this inferior root of ansa cervicalis unites with the superior root of ansa cervicalis, and this is called loop of hypoglossal nerve. So this is the hypoglossal nerve, this is the hypoglossal nerve, and this is the C1, a branch from the C1. So the C1 through hypoglossal gives rise to two branches, nerve to thyroid, and this is the superior root of ansa cervicalis. And C to C3 gives two branches and they form inferior root of ansa cervicalis or descendens cervicalis. We can call it as descendens cervicalis. And they form a loop called ansa cervicalis. And from the ansa cervicalis, three branches arise. They supply stenothyroid. So this is the superior root of ansa cervicalis and this is the inferior root of ansa cervicalis. This is called ansa cervicalis loop, and this from the loop of ansa cervicalis, three branches arise. They supply stenothyroid, stenohyoid and omohyoid. So from the loop of ansa cervicalis, three branches arise. They supply the stenothyroid muscle, stenohyoid muscle and omohyoid muscle. They are the infrahyoid group of muscles. The stenothyroid, stenohyoid, omohyoid, they are the infrahyoid group of muscles. So hypoglossal nerve, C1 through hypoglossal, it gives two branches. This is the hypoglossal nerve. A branch from the C1 supplies nerve to thyroid and superior root of ansa cervicalis. And C to C3, they give another branch that is called inferior root of ansa cervicalis. They form the loop of ansa cervicalis. From the loop of ansa cervicalis, we will give three branches come out. They supply stenothyroid, stenohyoid and omohyoid. So that is ansa cervical. Ansa cervicalis is very, very important. And coming to the vagus. So coming to the other content is vagus. So vagus now, it gives superior laryngeal branch, pharyngeal branch, and also it supplies carotid body and carotid sinus. And carotid body means the common carotid artery. Common carotid artery, before dividing into internal carotid artery and external, it forms a dilatation. We call it as carotid sinus. Common carotid artery, before divided into external carotid artery and internal carotid artery, it forms a dilatation that is called carotid sinus, and a oval body situated on the posterior part of carotid sinus, we will call it as carotid body. This carotid sinus and carotid body, they have rich nerve supply, and this carotid sinus, it acts as baroreceptors, and this carotid body acts as maintains the oxygen tension levels of the body. It acts as chemoreceptors. Carotid sinus act as baroreceptor, and carotid body act as chemoreceptor. So the common carotid artery the dividing point, it presents a dilatation that is called carotid sinus. On the posterior part of carotid sinus, we have a body called carotid body. So the vagus nerve, it also supplies twigs to the carotid sinus and carotid body, and it supplies pharyngeal branch, and the vagus nerve, the superior laryngeal nerve, again divides into, it gives superior laryngeal branch in the carotid triangle. The superior laryngeal nerve of vagus, it divides into external laryngeal and internal laryngeal. The superior laryngeal nerve of vagus, it divides into external laryngeal and internal laryngeal. External laryngeal nerve, it supplies the cricothyroid, and internal laryngeal nerve, it is sensory, and it supplies the mucous membrane up to the level of vocal folds. So the vagus nerve here in the carotid triangle, it gives pharyngeal branches, and it gives branches to the carotid sinus and carotid body, and it gives a superior laryngeal branch. The superior laryngeal branch divides into external and internal laryngeal. External laryngeal supplies the cricothyroid, and it is motor, and internal laryngeal nerve, it is sensory and supplies the mucous membrane up to the level of vocal folds. And along with that structures, we can see parotid gland. Parotid gland, some part of the parotid gland, it is seen in the carotid triangle, and jugular digastric and jugular omohyoid group of lymph nodes, they are also seen in the carotid triangle. So these are the contents of the carotid triangle. So the carotid triangle, it is in front and above, it is formed by stylohyoid muscle and posterior belly of digastric. In front and below, it is formed by superior belly of omohyoid. Posteriorly, it is formed by the anterior border of sternocleidomastoid. Floor is formed by hyoglossus, middle constrictor and inferior constrictor, and middle constrictor and the inferior constrictor, they go onto the backside of the pharynx, and they inserted in the pharyngeal raphe there, and the inferior constrictor, it arises from oblique line of thyroid cartilage and cricoid cartilage, and it also goes to the backside posterior part of the pharynx, and the three constrictors, superior constrictor, middle constrictor, inferior constrictors of pharynx, they go backside of the pharynx, and they inserted over there. And coming to the contents, common carotid artery at the level of the upper border of thyroid cartilage divides into external carotid artery and internal carotid artery. And internal carotid artery, it enters into the base of the skull, and it enters the brain through the carotid canal and supplies the major part of the brain. And coming to the external carotid artery, it supplies mostly the head and neck region. In the carotid triangle, we will be able to see 5 branches. There are superior thyroid artery, lingual artery, facial artery, occipital artery, and ascending pharyngeal artery. Superior thyroid, lingual artery supplies the tongue, facial artery supplies the face, occipital artery supplies the occipital region of the skull, and and here is the ascending pharyngeal artery which supplies the pharyngeal region. And coming to the internal jugular vein, this internal jugular vein, common carotid artery along with internal carotid artery and vagus nerve, they are enclosed in a sheath is called carotid tissue, which is derived from the deep cervical fascia. The posterior part of the internal jugular vein, the carotid sheath, it is very thin to allow the venous expansion. And coming to the nerves, spinal accessory nerve and is here on the upper part of the triangle, and loop of hypoglossal nerve, here is the hypoglossal nerve. The branch from the C1 passes along with the hypoglossal nerve and supplies the nerve, thyroid nerve to thyroid and superior root of ansa cervicalis. We can call it a descendants hypoglossae also. And branches from the C2, C3, they unite to form the inferior root of ansa cervicalis. This is the loop of ansa cervicalis which supplies the sternothyroid, sternocleidomastoid and omohyoid group of muscles. These are the infrahyoid group of muscles. And coming to the vagus nerve, it gives many branches in the carotid triangle. They are the pharyngeal branches to the carotid body and carotid sinus. The carotid body, it is carotid sinus is fusiform dilatation at the bifurcation, and carotid body is the oval body situated at the posterior part of carotid sinus. And the important branch of the vagus nerve is the superior laryngeal branch, which divides into external and internal. External laryngeal branch, it is motor and it is supplies the cricothyroid muscle. Internal laryngeal, it is sensory and it supplies the mucous membrane up to the level of vocal folds. And a part of parotid gland is also seen in the carotid triangle, and jugulo-digastric and jugulo-omohyoid group of lymph nodes are also seen in the carotid triangle. And carotid sinus is a baroreceptor and carotid body is a chemoreceptor. It maintains the oxygen levels in the body and it maintains the blood pressure in the body. So these are contents of the carotid triangle. So, coming to the digastric triangle, the digastric triangle, it is bounded above by the lower border or base of the mandible and imaginary line extending from the angle of the mandible to the mastoid process. And below and in front, we have anterior belly of digastric, and behind and in back, we have stylohyoid muscle and posterior belly of digastric. So, below and in front we have anterior belly of digastric, below and in front we have anterior belly of digastric, and below and behind we have posterior belly of digastric and stylohyoid muscle. And base of the triangle, it is formed by the lower border of the mandible and also the imaginary line extending from the angle of the mandible to the mastoid process. And coming to the floor, it is formed by three muscles: hyoglossus muscle from superficial to deep, mylohyoid muscle, hyoglossus muscle, and also some part of middle constrictor muscle. They are forming the floor of the digastric triangle. So the digastric triangle base is formed by the lower border of the mandible, and below and in front we have anterior belly of digastric, and below and behind we have styloglosshyoid muscle and also posterior belly of digastric. And floor, it is formed from superficial to deep. We have mylohyoid muscle, hyoglossus muscle and middle constrictor. And coming to the contents of the digastric triangle. Contents of the digastric triangle, we will able to see submandibular gland is here, superficial part of submandibular gland, superficial part of submandibular gland is here, superficial part of submandibular gland. So superficial part of submandibular gland, it lies in a groove in the submandibular fossa, between the mylohyoid groove and the submandibular fossa. Here. Some superficial part of submandibular gland is situated here, and the superficial part of submandibular gland, it is covered by investing layer of deep cervical fascia, and it is coronal, it is triangular on cross section, and it is having medial, lateral and inferior surfaces. So the investing layer of deep cervical fascia splits here, covering the inferior and medial surfaces of the gland. So the superficial part of submandibular gland can be seen in the digastric triangle, and also we can see facial vein. The facial vein, we know that the facial vein, it is formed by the union of common facial vein. It is found here is the facial vein, and it is formed by the anterior division of retromandibular vein and to form the common facial vein. And the facial vein is also seen, and more important thing is submandibular group of lymph nodes are seen. Superficial to the gland, we have some lymph nodes are seen. Superficial to the gland, we have submandibular group of lymph nodes are seen. Facial vein is seen. Of course, facial vein is formed by the union of common facial vein and also anterior jugular vein, which drains into interjugular vein, and submandibular lymph nodes are seen superficial to the gland. They also forms the main content of the digestive triangle. These submandibular lymph nodes, they swell during any infections, and they like superficial to the gland. They drain a wide area of face. And facial artery. Facial artery, it is situated in the digestive triangle before entering into the face. So the facial artery, it forms an the facial artery forms a this shaped course. The ascending part lies in the posterior part of submandibular gland, and the descending part, it lies in the mandibular fossa, in between the mandibular fossa and the submandibular gland. So it maintains a course like in this shape, the facial artery. The facial artery maintains a course like this shape. This is the ascending loop and this is the descending loop. The ascending loop, it lies in the posterior part of submandibular gland, and the descending loop, it lies in between the submandibular gland and the fossa, and it enters the face at the anteroinferior angle of the mandible. So the facial artery can also be seen. Before entering into the face, the facial artery gives one artery that is called submental artery. Submental artery, which is crossed superficially by the marginal mandibular branch of facial nerve. So the facial artery, before entering into the face, it gives one important branch that is called submental artery. And coming to the other structures, we can see mylohyoid nerves and vessels. So mylohyoid nerves and vessels. Mylohyoid nerve is a branch of inferior alveolar nerve of mandibular nerve. So the mylohyoid nerves and vessels, we can see here, the mylohyoid nerves and vessels, they supply the anterior belly of digastric. The mylohyoid nerves and vessels, they supply the anterior belly of digastric and also mylohyoid muscle here. So this is the anterior belly of digastric, and they also supply the mylohyoid muscle here. So mylohyoid nerves and vessels, mylohyoid nerve is a branch of inferior alveolar nerve, which is in turn is a branch of mandibular nerve. They supply the anterior belly of digastric and also mylohyoid muscle. And we can see along with these structures, we can see some part of parotid gland is also present in the digestive triangle, and these are the contents of the digestive triangle. So coming to the contents of the digestive triangle, we will able to see the first one is superficial part of submandibular gland, and along with the submandibular gland, we have facial vein and submandibular lymph nodes are there, facial artery is there, mylohyoid nerves and vessels are there, and along with them we have some part of parotid gland is also present in the digestive triangle. And external carotid artery, before entering into the gland, it lies in the groove, and it is also seen in the digestive triangle. External carotid artery, which is a branch of common carotid artery, it is also seen. External carotid artery is also seen in the digestive triangle. External carotid artery here. So these are the contents of the digestive triangle. So the digestive triangle consists of superficial part of submandibular gland, facial vein and submandibular lymph nodes, facial artery is there, and mylohyoid nerves and vessels which supply the anterior belly of digastric and mylohyoid muscle. And this is the external carotid artery is seen, and in the posterior part of digestive triangle, and some part of parotid gland is also seen. Here we can see the parotid gland is also Parotid gland is also seen here in the digestive triangle. Parotid gland. Here it is also seen in the digestive triangle. These are the contents of the digestive triangle. So coming to the submental triangle. Submental triangle, the apex is formed by the symphysis mentae, base is formed by the hyoid bone. On either sides we have anterior belly of digastric. On either side we have anterior belly of digastric. So submental triangle. Submental triangle, we have apex is formed by the symphysis mentae, base is formed by the anterior triangle, hyoid bone. On either sides we have anterior belly of digastric. And coming to the floor is formed by the mylohyoid muscle. These two mylohyoid muscles, they are united by a median raphe which forms the diaphragma oris. And contents of the submental triangle, there are only two contents are there. They are submental lymph nodes which drain the lymph from the chin and the skin area here, and submental lymph nodes, they are 3 to 4 here. They are situated here in the submental triangle, and commencement of the anterior jugular vein is seen in the submental triangle. So that's about the submental triangle. So coming to the digestive triangle, once again the digestive triangle, at base it is formed by the lower border of the mandible, and in front, below and in front it is formed by the anterior belly of digastric, and below and behind it is formed by the stylohyoid muscle and posterior belly of digastric. The floor it is formed by, from superficial to deep, it is formed by mylohyoid, then hyoglossus and middle constrictor muscle. And coming to the contents are superficial part of submandibular gland is here, facial vein and submandibular group of lymph nodes, facial artery, mylohyoid nerves and vessels, and also we can see the external carotid artery lies in a groove before entering into the parotid gland, and some part of parotid gland is also seen in the digestive triangle. So, and coming to the submental triangle, the base is formed by the hyoid bone and apex is formed by the symphysis mentae. On either side we have anterior belly of digastric, and on floor it is formed by the mylohyoid line that is united by a median raphe which from the diaphragma oris. This mylohyoid muscle, it is supplied by mylohyoid nerve which also supplies the anterior belly of digastric. And the contents, we have submental lymph nodes. Submental lymph nodes, they are 3 to 4 in number, and they drain the chin area here. And coming to the comments, and other content is anterior jugular vein starts in the submental triangle. So that's the end of the anterior triangle of neck.